The nice thing about the ForeseeHome device is it's something that they're actively involved in monitoring their vision at home, and there's real data being collected. If there is an abnormality in their pattern of central vision, the device and its software will detect it. It'll transmit that data to a reading center, and often it'll allow the patient to be notified and for our office to be notified so we can see them, check it out, and initiate treatment well before they have significant vision loss at all, and even before they even have any symptoms. So they won't even see anything. They'll just do their test, but the test will detect an area of abnormality. It will be contacted. We'll call them in for an appointment, and then when we look inside, in fact, there it is. There's an area that is leaking. And we had a few patients in our initial series of patients using this device that actually were detected before they had any vision loss, before they had any symptoms. We got them in early. They still had the 20/20, 20/25 range of vision, and they were able to be treated and be maintained at that excellent level of vision despite having the disease, because our treatments are very effective once we initiate them, especially at early stages. Well, I think there are a couple of things. The sensitivity of the test, based on its software and its mechanism, is much better. With the ForeseeHome device system, where the reading center contacts us in the office and we get them in within a couple of days, is much more effective in getting them in early. The Amsler Grid, often they'll take it home, they'll use it for a while, then they'll forget about it, and then they won't use it for months till their next visit. Maybe they'll use it a little bit before their next visit when they're reminded to start using it again. Or maybe they will be reminded at the visit, so they'll use it again, but it's not something that is maintained. They have RPE clumping or drusen in the category that we term intermediate AMD. That means that we feel that they have a significant risk of progression, and I'd like to check on them and be able to pick it up as early as possible. A perfect example is someone who already has wet AMD in one eye and is functioning well with the other eye. Whether they're functioning well or not with the wet AMD eye is irrelevant, but we know that they're at high risk because they already had one eye that developed this problem, and they're usually quite concerned. And the best way to catch it really early so they can maintain excellent visual acuity in their eye that is not progressed to wet AMD is to use the ForeseeHome device regularly, so that if there is ever a progression, if there is ever the development of wet AMD, we catch it early and treat it. The patients are evaluated to see if they have significant risk of progressing to wet AMD, and if so, they're counseled as to the potential use of this device. If they have interest, then they see another staff member who will see if they qualify, meaning they have the dexterity and the understanding to be able to perform the device and get accurate testing. They come in for their regular visits as they would, whether it's every few months, every 6 months, whatever it might be. But if there's an alert, if there's a concern, then the office is notified.